Welcome back, everyone, to the 21st Century Man podcast. Today, we're going deep, really deep, into something pretty crucial for all you guys out there, men's health.
That's right, and we're doing it by cracking open this really insightful book, The 21st Century Man, and specifically zeroing in on Chapter 19.
Yeah, Chapter 19 tackles infectious conditions in men, and our goal today is to, well, kind of sift through it all, separate what's really important from all the background noise.
Exactly. Think of this as your cheat sheet to understanding what infections can really mean, especially as men get older, how they affect us differently. We're going right to the source here, tapping into the expertise of Dr. Josh Perlroth.
Dr. Perlroth, he's an infectious disease specialist, so he knows his stuff, and he actually wrote this whole chapter. And we might even sprinkle in some wisdom from Dr. William Schaffner, just to round things out.
Oh yeah, Dr. Schaffner's a legend. But really, the big question here is, why does all this even matter?
Right, why should we care? Well, it comes down to this. As we age, our bodies change, right? And our immune systems, those amazing defenses we have, they change too. Sometimes that means we're a bit more susceptible to getting sick, to those pesky infections.
And that's exactly what we're diving into. We'll cover the whole spectrum, from those everyday bugs that just seem to hang around forever to those more serious conditions that really need our attention. But the focus is always going to be on what you need to know and what you can actually do about it.
Actionable advice. That's what we're all about. So let's jump right in. The chapter starts off by tackling those chronic infections, the ones that can really drag on.
And what's interesting is realizing that an infection isn't always like a quick sprint, in and out. Sometimes it's more like a marathon, and that recovery period, it can have its own challenges.
It's like dealing with the aftermath, the lingering effects.
All right. And the book starts with diverticulitis. Now, that's a mouthful, but it's basically an inflammation of these tiny pouches that can form in the wall of your colon.
So we're talking about diverticulosis and diverticulitis. Okay, let's break it down. Diverticulosis is just having those little pouches, the diverticula, in your colon wall. No big deal, right?
Well, not necessarily a big deal on its own, but Dr. Perlroth points out that it's becoming super common, especially in Western countries. And guess what? About half of all people aged 60 and over have these pouches.
Wow, half. That's a lot.
It is. And a big reason, according to the book, is a lack of fiber in our diets. That good stuff you find in fruits and vegetables.
It's like our colon needs that fiber to keep things moving smoothly.
Exactly. Think of it like a well-oiled machine. Without enough fiber, things get kind of backed up, and that creates pressure points where these pouches, the diverticula, can form. And when those pouches get inflamed, bam, you've got diverticulitis.
Ouch, not fun. And I guess with so many people having diverticulosis, the chances of developing diverticulitis are pretty high too.
You got it. About 25% of folks with those pouches will eventually experience diverticulitis. And get this, by age 80, almost everyone has symptoms.
So it's not just about avoiding discomfort in the moment, it's about preventing potential problems down the road.
Exactly. Now, switching gears a bit, the next topic might not be what you'd expect when thinking about older adults: sexually transmitted infections.
STIs.
Yeah.
Yeah, you might think that's a younger person's problem, but that's not always the case.
Unfortunately, no. Infections like syphilis, gonorrhea, chlamydia, even HIV, they don't discriminate based on age. And the numbers are pretty sobering. In 2018 alone, there were almost 2.5 million cases of chlamydia, gonorrhea, and syphilis reported.
Wow, that's a huge number.
It is, and the book actually dives deeper into this in Chapter 93, so it's definitely worth checking out for more detail. But the point is, staying informed and protecting yourself is important at any age.
Absolutely. Awareness is key. Now, moving on, the discussion shifts to prostatitis.
Prostatitis is basically inflammation of the prostate gland. And trust me, it's something a lot of men will encounter at some point.
So how common are we talking?
Well, the lifetime risk is about 8.2%. That translates to almost 2 million doctor visits every year just for prostatitis.
Wow. Okay, so what causes it?
A few things, actually. STIs can trigger it, bacterial bladder infections, and even some medical procedures that involve the prostate.
So it's not something to just brush off.
No, definitely not. The chapter makes a really important point. Prostatitis needs to be taken seriously. It's been linked to prostate cancer, so you don't want to ignore it.
I see. So it's like a warning sign.
Yeah, more of a correlation than a direct cause and effect thing, but it's something to talk to your doctor about for sure.
Absolutely. Early detection is always key. And that's what makes this chapter, this whole book, so valuable. It connects the dots between different health issues, helps you see the bigger picture.
Totally. And speaking of connecting dots, the next chronic infection discussed is herpes zoster, better known as shingles.
Shingles, yeah, I've seen the effects of that firsthand. It can be pretty rough.
It can be, and here's the thing. It's actually a reactivation of the chickenpox virus. Remember chickenpox?
Yeah, how could I forget?
Well, if you're over 40, you probably had it as a kid, which means you're carrying that dormant virus, just waiting for the right moment to reemerge as shingles.
Wow, so that childhood virus can really come back to haunt you? That's scary.
It is, and it happens a lot. 1 million cases in the U.S. every year, actually.
1 million. Seriously.
Yeah, and the chances of getting it really go up with age.
Like how much?
Think about it like this. For every 1,000 people, about 4 will get shingles in any given year. But for those over 60, it jumps to 1 in 100.
That's a big difference.
Huge. And it's not just the frequency, it's the severity, too. Shingles can lead to this long-lasting nerve pain called postherpetic neuralgia in almost 20% of
I
cases.
can only imagine how debilitating that must be.
Absolutely. It can seriously impact your quality of life. And the numbers just get more stark as you age. 2% risk under 50, over 20% after 50, and over 35% for those over 80.
Wow, those numbers are really eye-opening.
They are. Now let's move on to some more common infections, the kind you might not even think twice about. Skin infections.
Right, like those annoying abscesses or boils and cellulitis, that deeper skin infection.
Exactly. They might seem like minor inconveniences, but they become way more common in middle-aged men. Up to 200 cases per 100,000 patient years, according to the book.
Patient years, what does that even mean?
It's basically a way to account for the number of people studied over a certain amount of time. Gives you a clearer sense of the overall risk. But the point is, skin infections are something to be aware of.
So what makes someone more likely to get them?
Well, Dr. Perlroth lists a bunch of factors. Anything that breaks down your skin's protective barrier, like a cut or scrape, swelling from poor lymphatic drainage or vein issues, obesity, and a weakened immune system from things like diabetes or HIV.
So it's often a combination of things.
Right. Now, last but not least, in this section on chronic infections, we've got dental cavities.
You mean those things we get filled at the dentist?
Those are the ones you might think, oh, just a cavity, no big deal. But Dr. Perlroth shares his experience of seeing some really tricky dental infections, the kind that don't go away easily.
So even something seemingly minor can become complicated.
Exactly. And it's a good reminder to take care of your teeth. In fact, chapter 53 of the book is all about optimal dental care, so definitely check that out.
Prevention is key, right?
Always. Okay, now we're moving into the heavy hitters, severe infections. And unfortunately, these become more common as men age too.
Things are getting serious now.
They are. We're talking about conditions like sepsis and, of course, influenza and pneumonia. Let's start with sepsis.
Right, sepsis? What's the deal with that?
So sepsis is when an infection, any infection, gets into your bloodstream and basically throws your whole body into chaos. You get a fever, your blood pressure plummets dangerously low. It's bad news.
Sounds terrifying.
It is. And the recovery, even if you survive, can be brutal, especially if surgery is involved.
Yikes. And I remember reading that sepsis can even lead to septic shock, which is basically a death sentence, right?
Sadly, you're right. And the statistics are pretty grim. According to the CDC, 1.7 million Americans develop sepsis every year, and 270,000 of them die.
That's a staggering number.
It is. And it's even a factor in 1/3 of all deaths in hospitals.
So even what starts as a seemingly ordinary infection can have devastating consequences.
Absolutely. It really puts things into perspective. Now let's talk about influenza and pneumonia.
Yeah, most people just think of those as bad colds, right?
You'd think so, but they're actually still major killers, especially for older adults. They're consistently in the top 10 causes of death.
Wow, I had no idea.
It's true. The CDC reports 250,000 hospitalizations for pneumonia each year, and around 50,000 people die from it.
So these are not just minor inconveniences.
No, they're serious threats. Now, the next section of the chapter dives into what makes men more vulnerable to these infections.
The risk factors, right?
Exactly, and there's a pretty long list. First up is obesity.
Obesity. I can see how that might make things more complicated.
It does. Dr. Perlroth explains that it affects everything from antibiotic dosage to recovery time, even surgical outcomes.
Makes sense. So what else is on the list?
Well, unfortunately, just getting older is a risk factor in itself.
Father time is undefeated, right?
Pretty much. As we age, our immune systems just don't function as well. Think of it like this. Your immune system is like an army. As you get older, the training camps, where the new recruits learn to fight, they're not as efficient, and the overall production of new soldiers slows down.
I see. So there are fewer reinforcements available to fight off infections.
Exactly. And that's why vaccines often aren't as effective in people over 65.
Makes sense. What about stress? Everyone knows stress is bad for you, right?
It is, and the chapter specifically links it to poorer immune health.
So managing stress is important.
Hugely important. And then there's excessive alcohol consumption.
The booze.
Chronic alcohol use can damage your liver, and your liver plays a key role in your immune system.
So too much alcohol can weaken your defenses.
Right, and it specifically increases the risk of this nasty infection called Vibrio vulnificus, which you can get from eating raw shellfish, especially oysters.
Raw oysters, so keep that in mind.
You should. It can also make other bacterial infections worse. So moderation is key, especially as you get older.
Good advice. Now, what about those everyday bugs we get from our families?
Yeah, those seemingly harmless infections that kids bring home from school or daycare.
Like what?
Things like parvovirus, Coxsackie virus, which causes hand, foot, and mouth disease, influenza, chickenpox, strep throat. These can be surprisingly tough on adults who haven't had them before.
So even though they seem minor, they can pack a punch.
Exactly. Now, another thing to consider is travel.
Yes, the joys of international travel.
Right, but with travel comes exposure to all sorts of new bugs.
Like what?
Well, depending on where you go, you could encounter malaria, dengue fever, chikungunya virus. Cruise ships are notorious for norovirus outbreaks.
Not the kind of souvenir you want to bring home.
Definitely not.
Oh.
And if you're camping in North America, there's always the risk of Lyme disease, tularemia, even plague.
Plague? Seriously?
Yeah, it's still out there.
I'll stick to the well-traveled paths.
Probably a good idea. And no matter where you go, there's always the risk of traveler's diarrhea.
Yes, the dreaded traveler's trot.
The book actually recommends getting vaccinated for typhoid and yellow fever if you're traveling to certain areas and carrying antibiotics for diarrhea, just in case.
Smart advice.
Now, another risk factor that's becoming more common is the use of immune-suppressing medications.
What kind of medications are we talking about?
These are drugs used to treat things like rheumatoid arthritis, autoimmune diseases, and even cancer. They work by basically dialing down the immune system's activity.
So it's like intentionally weakening your defenses.
In a way, yes, but it's necessary to manage those conditions. The downside is that it leaves you more vulnerable to opportunistic infections, the kind that wouldn't normally affect someone with a healthy immune system.
I see, it's a trade-off.
Right. Now, another big issue is antibiotic overuse.
I've heard about that. Antibiotic resistance, right?
Exactly. When we use antibiotics too much, especially when they're not needed, like for viral infections, it gives bacteria a chance to adapt and become resistant.
And then the antibiotics don't work anymore.
Exactly. And it's a huge problem. Over 2.8 million antibiotic-resistant infections occur in the U.S. every year, leading to over 35,000 deaths.
That's a lot.
It is. And Dr. Perroth points out that infections that were once easily treated now require stronger, broader spectrum antibiotics or even combinations of different antibiotics.
So the bugs are getting tougher.
They are. And it's not just about the resistance. Antibiotics themselves can have side effects.
Like what?
Well, they can disrupt the balance of good bacteria in your gut, which can lead to diarrhea and even a nasty infection called C. diff.
C. diff, I've heard of that. It can be pretty serious, right?
It can be. In 2017, there were almost 224,000 cases and at least 12,800 deaths from C. diff.
Wow, that's scary.
It is. And other potential side effects include allergic reactions, fatigue, and even tendon problems with certain types of antibiotics.
So it's important to use antibiotics wisely.
Absolutely. Only when they're absolutely necessary.
Good advice. Now, what about boosting our immune systems?
That's where the next section of the chapter comes in, lifestyle factors.
So what can we actually do to stay healthy?
Well, the book emphasizes that making healthy lifestyle choices is the most effective way to keep your immune system strong.
So it's not about some magic pill or potion.
Nope. It's about the basics.
Like what?
Don't smoke, eat a healthy diet, lots of fruits and vegetables, get enough sleep.
The usual suspects.
Exactly, but they're important suspects. And don't forget, exercise.
Exercise. Always a good thing.
The chapter actually talks about how even a single bout of exercise can increase the circulation of those infection-fighting white blood cells.
So getting your blood pumping helps your immune system.
Right. And if you do at least 5 days a week of aerobic exercise, you can reduce your risk of upper respiratory infections, like colds, by over 40%.
That's significant. What about things like probiotics and vitamins?
Good question. Probiotics are popular, but the evidence doesn't really support them for preventing infections. They might help with antibiotic-associated diarrhea, though.
Interesting. And what about vitamins?
Well, if you're already getting enough vitamins from your diet, taking supplements won't really boost your immunity. The benefit is only there if you're actually deficient in a particular vitamin.
So no need to megadose on vitamins.
Not really. And finally, don't forget about good old-fashioned hand washing.
Hand washing, always a good idea.
The chapter points out that there's no evidence that antibacterial soap is any better than regular soap. It's the act of washing that matters.
So scrub those germs away.
Now let's talk about medical interventions.
Things doctors can do to help us stay healthy.
Exactly. And one of the most important interventions, without a doubt, is vaccines.
Vaccines. I'm all for vaccines.
Me too. Dr. Perroth calls them one of the most effective tools in history for preventing infectious diseases. I mean, think about it. We eradicated smallpox and nearly eliminated polio thanks to vaccines.
That's amazing.
It is. And for adults over 40, the key vaccines to keep in mind are the ones for COVID-19, influenza, pneumonia, and shingles.
Okay, let's break those down. What about the shingles vaccine?
The shingles vaccine, Shingrix, is over 90% effective at preventing shingles and that nasty nerve pain that can come with it. And the protection lasts for at least 4 years.
That's impressive. And what about pneumonia vaccines?
There are actually two main types that protect against Streptococcus pneumonia, the bacteria that causes a lot of pneumonia cases.
Two types.
Yeah. One is called Pneumovax, and it covers 23 different subtypes of the bacteria. It's about 60 to 70% effective. The other one, Prevnar, covers 13 subtypes and has been shown to prevent pneumonia hospitalizations in 73% of adults 65 and older.
So there are options. And what about the flu shot?
The influenza vaccine is super important too. Its effectiveness can vary from year to year, depending on how well the vaccine matches the circulating flu strains.
I've heard about that.
But even if it's not a perfect match, it can still reduce the severity of the flu if you do get sick.
So it's still worth getting.
Definitely. Now, beyond vaccines, the chapter also mentions health screenings and testing.
Like what?
Well, a colonoscopy, for example, is primarily for colon cancer screening, but it can also spot diverticulosis, those pouches we talked about earlier.
So it's like a 2-for-1 deal.
Exactly. And early detection of diverticulosis can help prevent diverticulitis down the road.
Makes sense.
And finally, the chapter emphasizes good dental health.
Brushing and flossing.
More than that, actually. Poor dental hygiene and gum disease are serious infections in themselves.
Wow, I never thought of it that way.
And they've even been linked to other health problems like cardiovascular disease.
So taking care of your teeth is important for your overall health.
Absolutely. It all ties back to that interconnectedness we've been talking about.
Right, everything is connected.
This chapter from the 21st Century Man is truly a goldmine of information. Dr. Perroth has done a fantastic job of breaking down a complex topic and making it easy to understand. And he doesn't just tell you what the problems are. He gives you practical advice on what you can do about them.
I totally agree. This is an invaluable resource for any man who wants to take control of his health, especially as he gets older.
Absolutely. And we highly recommend reading Chapter 19 in its entirety and, frankly, the whole book. It's packed with insights that can help you live a longer, healthier life.
Couldn't have said it better myself.
Ah.
So there you have it, folks. That's our deep dive into Chapter 19 of the 21st Century Man. Stay tuned, because next time we'll be exploring Chapter 20, how your immune system works.
We'll be building on what we discussed today and going even deeper into those amazing defense mechanisms that keep us healthy.
Until then, be well, stay informed, and take good care of yourselves.
See you next time.